This is National Breast Cancer and Ovarian Cancer Awareness Month, so it's really a good time to talk about women's reproductive health in general. And joining us now with some news on that front is Suncoast gynecologist Dr. Michael Swor. Thank you so much for coming in. It's good to see you.
Thanks, Heidi.
Now, I know that there are a number of clinical trials going on, and this is very good for women here, right?
Oh yeah, we do have some new things for women in clinical trials and through our practice.
Now, tell me about one. One is about fibroids.
Yep, fibroids, traditionally the treatment's been kind of difficult. It required surgery, but there's a new pill that shrinks fibroids with very little side effects, and we're involved in a clinical trial, and it's actually open and available to women in the area right now. And there's 4 gynecologists in the area participating.
So that's pretty promising, instead of having to go through the pain of surgery, even though it's minimally invasive now.
Right.
Just to simply take a pill. Does it hold a lot of promise?
Yeah, it looks great.
Okay.
Yeah, real exciting.
What else? What other kinds of clinical trials?
Well, there's a new Pap test, new technology in reading the Pap and the HPV virus that sometimes is associated with abnormal Paps. And that's also a study that's being done nationally, and we're fortunate here in Sarasota to be able to participate in that study too.
Now, why do we need something like that? What kind of a difference would it make?
More sensitive, better test, more specific, helps diagnose things before they become a big problem.
And sometimes there are false negatives or false positives or positive negatives, all those backward things.
Right.
How often are you seeing that?
Actually, Pap tests are pretty good. They've gotten better over the last few years with the liquid-based Pap, and now this is supposedly the latest and greatest thing. So we'll see.
Okay, and I know another one really might help some women here on the Suncoast, especially the elderly population. Tell us about that.
Well, we have a new treatment that's being tested for low libido in women. And of course, in men's health, they have some special treatments there. So this is very promising in women's health. And we're happy that we were involved in the original study on that. And now there's a new one out there that's also open and available to women, actually of all ages.
And as far as that kind of a drug or a pill that you would take, there are some things on the market right now. How would this be different?
This is would be the first oral medication for low libido in women approved.
And how many of your patients are you seeing who complain of that?
There's quite a few. I would say probably 1 out of 10 women have some issues in that area at some time in their life.
All right. So if you're interested in taking part in any of these studies, what do you do?
Well, you can call our office or you can call Physician Care Clinical Research and find out about the studies, and you can be involved. The treatment is free. The testing is free. Patients are actually paid to participate for their time and travel. And the physicians who send the patients can be involved as well.
Great. Okay, good news. Mike Swor,
All right,
thanks very much.
Thank you.
And if you'd like more information, just go to mysuncoast.com and click on My Suncoast Health. That's where you'll see the website for SWOR Women's Care.